Coronavirus and COVID-19, what you should know. Photo of virus 3D render read in this article. What is COVID-19? Symptoms of COVID-19. Causes of the new coronavirus. Coronavirus risk factors. Coronavirus transmission. Coronavirus diagnosis. Coronavirus prevention. Coronavirus vaccine. Coronavirus treatment. COVID-19 outlook. Past coronaviruses. Editor's note: for the latest updates on the 2020 coronavirus outbreak, see our news coverage. What is COVID-19? A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronaviruses aren't dangerous. In early 2020, after a December 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 as a new type of coronavirus. The outbreak quickly spread around the world. COVID-19 is a disease caused by SARS-CoV-2 that can trigger what doctors call a respiratory tract infection. It can affect your upper respiratory tract, sinuses, nose and throat, or lower respiratory tract, windpipe and lungs. It spreads the same way other coronaviruses do, mainly through person-to-person contact. Infections range from mild to deadly. SARS-CoV-2 is one of 7 types of coronavirus, including the ones that cause severe diseases like Middle East Respiratory Syndrome, MERS, and Sudden Acute Respiratory Syndrome, SARS. The other coronaviruses cause most of the colds that affect us during the year but aren't a serious threat for otherwise healthy people. Is there more than one strain of SARS-CoV-2? It's normal for a virus to change, or mutate, as it infects people. A Chinese study of 103 COVID-19 cases suggests the virus that causes it has done just that. They found 2 strains, which they named L and S. The S type is older, but the L type was more common in early stages of the outbreak. They think one may cause more cases of the disease than the other, but they're still working on what it all means. How long will the coronavirus last? It's too soon to tell how long the pandemic will continue. It depends on many things, including researchers' work to learn more about the virus, their search for a treatment and a vaccine, and the public's efforts to slow the spread. More than 100 vaccine candidates are in various stages of development and testing. This process usually takes years. Researchers are speeding it up as much as they can, but it still might take 12 to 18 months to find a vaccine that works and is safe. Symptoms of COVID-19. The main symptoms include fever, coughing, shortness of breath, trouble breathing, fatigue, chills, sometimes with shaking, body aches, headache, sore throat, loss of smell or taste, nausea, diarrhea. The virus can lead to pneumonia, respiratory failure, septic shock, and death. Many COVID-19 complications may be caused by a condition known as cytokine release syndrome or a cytokine storm. This is when an infection triggers your immune system to flood your bloodstream with inflammatory proteins called cytokines. They can kill tissue and damage your organs. If you notice the following severe symptoms in yourself or a loved one, get medical help right away. Trouble breathing or shortness of breath, ongoing chest pain or pressure, new confusion, can't wake up, fully bluish lips or face. Strokes have also been reported in some people who have COVID-19. Remember fast. Face. Is one side of the person's face numb or drooping? Is their smile lopsided? Arms. Is one arm weak or numb? If they try to raise both arms, does one arm sag? Speech. Can they speak clearly? Ask them to repeat a sentence. Time. Every minute counts when someone shows signs of a stroke. Call 911 right away. If you're infected, symptoms can show up in as few as 2 days or as many as 14. It varies from person to person. According to researchers in China, these were the most common symptoms among people who had COVID-19. Fever 99%, fatigue 70%, cough 59%, lack of appetite 40%, body aches 35%, shortness of breath 31%, mucus, phlegm 27%. Some people who are hospitalized for COVID-19 have dangerous blood clots, including in their legs, lungs, and arteries. What to do if you think you have it? If you live in or have traveled to an area where COVID-19 is spreading. If you don't feel well, stay home. Even if you have mild symptoms like a headache and runny nose, stay in until you're better. This lets doctors focus on people who are more seriously ill and protects healthcare workers and people you might meet along the way. You might hear this called self-quarantine. Try to stay in a separate room away from other people in your home. Use a separate bathroom if you can. Call the doctor if you have trouble breathing. You need to get medical help as soon as possible. Calling ahead rather than showing up will let the doctor direct you to the proper place, which may not be your doctor's office. If you don't have a regular doctor, call your local board of health. They can tell you where to go for testing and treatment. Follow your doctor's advice and keep up with the news on COVID-19. Between your doctor and healthcare authorities, you'll get the care you need and information on how to prevent the virus from spreading. For more information about COVID-19, see our FAQ. How do I know if it's COVID-19, a cold, or the flu? Symptoms of COVID-19 can be similar to a bad cold or the flu. Your doctor will suspect COVID-19 if you have a fever and a cough, you live in an area with the virus or have traveled to places where it has spread. Cold versus flu versus allergies versus COVID-19. Symptoms: cold, flu, allergies. COVID-19 can range from moderate to severe. Fever, rare. High 100 to 102 F can last 3 to 4 days. Never. Common. Headache. Rare. Intense. Uncommon. Can be present. General aches, pains. Slight. Usual, often severe. Never. Can be present. Fatigue, weakness. Mild. Intense, can last up to 2 to 3 weeks. Sometimes. Can be present. Extreme exhaustion. Never. Usual, starts early. Never. Can be present. Stuffy, runny nose. Common. Sometimes. Common. Has been reported. Sneezing. Usual. Sometimes. Usual. Has been reported. Sore throat. Common. Common. Sometimes. Has been reported. Cough. Mild to moderate. Common, can become severe. Sometimes. Common. Shortness of breath. Rare. Rare. Rare, except for those with allergic asthma. In more serious infections. Loss of smell and taste. Sometimes. Sometimes. Never. Has been reported. Diarrhea. Never. Sometimes in children. Never. Has been reported. COVID-19 symptom checker. Find out if you have symptoms of coronavirus COVID-19. See what to do about your symptoms and whether to call a doctor. Is COVID-19 worse than the flu? Unlike the flu, a lot of people aren't immune to the coronavirus because it's so new. If you do catch it, the virus triggers your body to make things called antibodies. Researchers are looking at whether they give you protection against catching it again. The coronavirus also appears to cause higher rates of severe illness and death than the flu. But the symptoms themselves can vary widely from person to person. Is COVID-19 seasonal like the flu? A few lab studies have found that higher temperatures and humidity levels might help slow the spread of the coronavirus. But experts advise caution and say weather changes won't matter without thorough public health efforts. Also, past flu pandemics have happened year-round. Causes of the new coronavirus. Researchers aren't sure what caused it. There's more than one type of coronavirus. They're common in people and in animals including bats, camels, cats, and cattle. SARS-CoV-2, the virus that causes COVID-19, is similar to MERS and SARS. They all came from bats. Many people who got the disease early on were linked to a large live seafood and animal market in China. You might hear it called a wet market. The first cases may have come from animals sold in the market, then spread from person to person. Coronavirus risk factors: anyone can get COVID-19, and most infections are usually mild, especially in children and young adults. But if you aren't in an area where COVID-19 is spreading, haven't traveled from an area where it's spreading, and haven't been in contact with someone who has it, your risk of infection is low. People over 65 are most likely to get a serious illness, as are those who live in nursing homes or long-term care facilities, who have weakened immune systems, or who have medical conditions including high blood pressure, heart disease, lung disease, asthma, kidney disease that needs dialysis, obesity, diabetes, cancer treatment, especially chemotherapy, liver disease, cigarette smoking. Some children and teens who are in the hospital with COVID-19 have an inflammatory condition that doctors are calling multisystem inflammatory syndrome in children, or MIS-C. Doctors think it may be linked to the virus. It causes symptoms similar to those of toxic shock and of Kawasaki disease, a condition that causes inflammation in kids' blood vessels. Coronavirus transmission: how does the coronavirus spread? SARS-CoV-2, the virus, mainly spreads from person to person. Most of the time, it spreads when a sick person coughs or sneezes. They can spray droplets as far as 6 feet away. If you breathe them in or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can still spread the virus. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. Most viruses can live for several hours on a surface that they land on. A study shows that SARS-CoV-2 can last for several hours on various types of surfaces. Copper, 4 hours; cardboard, up to 24 hours; plastic or stainless steel, 2 to 3 days. That's why it's important to disinfect surfaces to get rid of the virus. Some dogs and cats have tested positive for the virus. A few have shown signs of illness. But there's no evidence that humans can catch this coronavirus from an animal. What is community spread? Doctors and health officials use this term when they don't know the source of the infection. With COVID-19, it usually refers to someone who gets the virus even though they haven't been out of the country or haven't been exposed to someone who's traveled abroad or who has COVID-19.